tuning into the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders. Today, we're going to do what we do best. We're going to provide eating disorder education, and we're going to do it with one of my most favorite people to treat eating disorders with, Dr. Amanda Smith. She is a licensed psychologist, and she's joining us today. She's the director of the Recovered Clinic in a different part of town, Arlington, Fort Worth. She's also a pediatric psychologist, expert working with children and families, and I think she loves eating disorder work, and so we're really excited to have you here today.
Yeah, thank you for letting me join today.
Awesome. No problem. We hope you come back over and over and over again because it's going to be really fun to talk about what we're going to talk about today. So we're going to focus on talking about why an eating disorder assessment is so important. We're going to share some real-life experiences that we've had with the different clients that we work with, and we're going to talk to you about some of the misnomers to eating disorder. In fact, many clients will come in to the clinic thinking that they either have like ADHD or anxiety or something that doesn't even really resemble an eating disorder. And then,
or even just behavioral issues in general.
Oh, yeah, behavioral issues, especially with younger kids. So we definitely see that. And then we do the assessment, and surprise, they actually meet criteria for an eating disorder.
Yeah.
So what are you seeing lately in clinic these days?
Yeah, I think it's always really hard to be able to say, okay, these are my symptoms, this is what I'm having, and then come in and think that's exactly what it is. There's so many other factors just attributing to different behaviors, different symptoms, whether it's difficulties concentrating or difficulty sleeping. And being able to assess for that nutritional piece of like what is going on with maybe an eating disorder or different patterns around food and how that impacts those presentations can be so different. So I think of even recently, I had someone that did get an evaluation for having concentration issues. They were diagnosed with ADHD. And then when I saw them, I started noticing there was so many behavior patterns around food that could be impacting their nutrition and therefore their concentration.
Okay, and that's a really, really good example. One of the things that we do in the Red Clinic is every client that we meet with, the initial appointment is always an in-depth assessment. And at Red Clinic, we like to do multidisciplinary team assessments. So it'll be either Dr. Smith or I as the psychologist on that team. And then we have a registered dietitian that also has expertise in eating disorders who will be a part of that assessment. And the difference with an eating disorder assessment really comes down to the fact that first it's multidisciplinary, but then there's also some really specific things that we look for, because we have that real trained eye to know how to ask different questions. If something kind of stands out to us, we may pick up on it, whereas someone else may not even think to ask certain questions.
Yeah.
And so I think you were sharing with me that maybe it was the same client, I'm not sure, but one of your clients during an assessment said something about just really nonchalantly, not really feeling like they have much of an appetite.
Yeah.
And that's a real common symptom, just in general, of any kind of disorder, is maybe a change in appetite.
Yeah, that could be depression, it can be anxiety, it could be trauma even related, or, just even thinking about during this time with the pandemic, everyone's appetite is sometimes just shifted based on different emotions. Our emotional connection with food is just so more in depth than what people mostly think of.
Yeah, and so because of your background and your training, that actually stood out to you and you followed up on it more so than maybe someone else may have in that exact same assessment. So what did you end up asking, that client, and what did you end up finding out?
Yeah, so some of the things that I just asked was, okay, so how often are you eating, right? What's happening there? How do you feel about food? Have you noticed yourself maybe pushing away food or limiting certain foods? Or, are you ever noticing emotions attached to food, whether it be guilt of eating or this like urge to keep on eating? And so even being able to just look into that and start noticing a pattern really allowed me to be able to lean on that dietitian and say, okay, like from this nutritional standpoint, what could be going on? And can we really even say there is maybe an underlying diagnosis of ADHD with this difficulties of concentrating without addressing the nutrition part first?
Okay. So essentially, even though the client had a diagnosis of ADHD given to him from some other provider, you were questioning if we can even go there at this point because the basics of just having enough nutrition weren't even being addressed.
Yeah, absolutely.
Okay. And so we know that if people aren't getting enough nutrition, a natural side effect of that is going to be concentration problems. So were you able to talk to the client about that?
Yeah, absolutely. And we were able to just even be able to say, hey, like, this is a really good opportunity because this means that there may not be something underlying. This may mean that we can actually address all of those concerns by just helping increase that nutrition.
Okay. And so like getting him on a structured meal plan and making some treatment recommendations that absolutely involves a dietitian was the next step for this client.
Yep.
How did the client do when he heard that, I may not even have ADHD and I've been treating myself for ADHD this whole time and maybe it's not even an issue for me?
Yeah, I mean, I think of this one case, but I've had actually several cases that this has happened. And so I think for each person, it's a little bit of a different process. Sometimes it's like, man, I thought I figured it out, but what about all these other things going on, which allowed us to have further conversation of like, what else is going on? What else could be attributing? Because, it's never just like one factor by any means, but it also gave this like relief of like, oh man, like if I can address this now diagnosed eating disorder, then I can gain all of this back.
Okay. And so it was good news to have a correct diagnosis for him.
Yeah.
So the client actually did meet criteria for an eating disorder?
Yes, this one did.
Okay. And so you don't think it was ADHD at all. Essentially, you like ruled that out after you got more information and your assessment revealed it was an eating disorder.
Yeah.
Okay.
And it could be like I said, I've seen it a couple of different times of just like being able to be like, you know what, let's even wait, and if they're still not convinced, I'm like, you know what, let's just at least get that nutrition piece taken care of right now. Let's see what happens after the nutrition is addressed. And then we can reassess even at that time because it is really hard. Sometimes a client may be so malnourished that it's even hard to be able to differentiate what's going on. But we do know the malnourishment is a big piece. And so if we can at least alleviate those, that piece of it and making sure that they're getting the right nourishment, then we can be able to really see what else is going on.
It's so interesting because hearing you talk about this is making me think about clients that actually have the exact opposite presentation. So they may be completely malnourished because they might be very deep in an eating disorder like anorexia or atypical anorexia, even bulimia. They could be very malnourished at the point that we see them.
Or even ARFID.
Yeah, ARFID, exactly, right? That's absolutely associated with malnutrition. And instead of having concentration problems, they're actually doing very well in school. They're still, the straight A student as they always have been. They're the high achieving valedictorian or president of the student council kind of kid. And the family members around them actually would never even consider that there's a problem because they're functioning just the way they always have.
Yeah.
So how do you explain that?
It's always so funny because I feel like you're absolutely right. And it all comes down to each person is different. Each body is different. I think of like, even just when I don't eat, how does that impact me compared to like even my husband or my child? I know I'm a little bit more on the hangry side. I just like start getting a little bit more irritated. And so it's like, oh, okay. Like this is just saying, I'm like, oh yeah, there's been a time change. Well, that's impacting my eating, so let me go ahead and make sure my body is nourished. Or, I think just even the people listening to this podcast, you can probably think of like your different kids or different family members and how everyone reacts differently to when maybe their body's not getting what they need. And so being able to understand that and understand how everyone's different, and also the eating disorder is different. So their lack of nourishment looks different for each person. That's why there's like, you know, a plethora of things that the medical providers and dietitians are looking for, because it's not just, you know, are they going to be just missing calories or energy intake? No, there's other things that are playing into it, and each person's a little bit different.
Yeah, and I totally agree with you. You know, everyone is super different, and so everybody's body reaction to malnutrition is going to look different. One of the things that I like to explain to families and just loved ones of individuals with eating disorders is that sometimes when we see that ability to continue to achieve very highly and do very well academically, it's because the malnutrition makes it so that resources are very refined, or, you know, the brain is functioning like on a very narrow pathway at that point. Yeah. So even if someone is really brain starved, for instance, they're still able to do the same things that they've always done just as well as ever. It's when you try to have a more complex conversation or introduce abstract processes or ideas, it's when they don't grasp it. Yeah. So then you see the side effects of malnutrition when you try to get them to think outside the box or do something that's not in line with their rigid routine. That's when you really see it. So it does show up. It just shows up differently for different people.
It's so interesting. You said brain starved, and I feel like that's something that we always talk about, but I feel like it's so hard for what other people think of. Like, how do you usually explain that to our clients, like brain starved?
When someone's brain starved?
Yeah.
So as soon as I say the word, even other clinicians, or the phrase, I guess, brain starved is a phrase. As soon as I say it, even other clinicians like have a strong reaction to that if they're not in the field, right?
Yeah.
So when I'm explaining that to clients or to family members, as soon as you say the phrase, they're like, that's what that is. Yes, I know what you're talking about. I've just never heard it put that way.
Yeah.
And it's really cool. It's like this almost therapeutic effect, because you're validating the experience they know they've been having with their loved one with the eating disorder, and it just finally puts into words what's going on. So when I explain brain starved, I really just talk about it as, you know, just like the rest of the body, the brain is not nourished. And an individual who is brain starved may present like you're having the same conversation with them over and over again, and nothing's really clicking. Or you actually said it earlier today when we were talking about what are we going to talk about today, and you said, you know, there's that experience.
It's like that, like kind of like deer in the headlights look, where it's like, you know, there's something going on, but it's just not processing in the same kind of way.
Yep. Or like the lights are on, but nobody's home, right? And so that's an experience of interacting with someone who's brain starved. And then the other aspect of it too is those routines. Going from point A to point B is so well practiced that they can continue to do those things well. So if, you know, studying and getting good grades is something they've always done, it's not going to seem like it's being affected. But then when you ask someone to go from point A to point C, right, and take a detour, it's really difficult for that person to grasp what we're talking about, or
kind of getting out of their routine and doing something new, or having to think in a different way becomes a lot harder.
Mm-hmm. And that's when we see, okay, this person may be really malnourished. So what other misnomers to eating disorders have you seen when you're doing the assessment?
Fidgeting. I feel like fidgeting is a huge one. So I feel like a lot of people don't always recognize fidgeting as a type of exercise, but a lot of times when someone's so enmeshed with their eating disorder, they are trying to find any way to gain more movement in order to like reduce the amount of energy their body is like taking in, essentially. And so, you know, all of a sudden it's like, well, they're bouncing off the walls right after dinner, or they just like can't sit still. And it's like, okay, what's really going on here? Why is it that they can't sit still? And so that's one of those big ones that I always am like very mindful and watchful of, because fidgeting could happen just even with anxiety in general, the tapping of the leg underneath the table, or the fidgeting with rings, or just even the fidgeting with like their hair, right? Or even just thinking of ADHD in general, right? There's a lot of fidgeting, lack of being able to sit still, that impulsive behaviors, but then you kind of go on this eating disorder side, and all of a sudden they're doing these things and pretending like it may be something they can't control, which that's kind of what's going on, is they're actually having a difficulty controlling that behavior because they feel this impulse to be able to do that. But the reason for it may be very different.
Yeah. And I mean, you use the word impulse. I think with ADHD, it is more impulsive when we see that type of fidgeting behavior, like the hyperactivity that comes with that diagnosis. And with an eating disorder, the fidgeting is more compulsive, so it's like this urge to do it, and it's such an uncontrollable urge they can't but help give into it. Yeah, I agree. Fidgeting is absolutely one of those like red flags. Like, when does the fidgeting actually occur, and what's the story behind it? So we definitely dig deeper as psychologists when we're doing that assessment.
Especially if it's all of a sudden there's a lot of movement right after meals.
Yes.
That's always like a big one that starts sending that red flag of like, okay, why is it after meals, And I think it's easy to kind of hide under that, well, I just had food, so I just have all this energy now, right? But what is kind of happening in that moment? Are they really, having more energy? Is that what's going on? Did they just have, a great meal? Or is there something else where it's like, no, I have this compulsion that I need to use this energy to burn off whatever I just ate?
Right. Exactly. Now, what about when individuals who are coming in maybe for like real high anxiety, and we see them kind of sitting at the edge of their chair, really up straight and things like that? Do you ever get clients talking about that in assessments?
They may not talk about it, but I may notice it. I was just going to say that. They may not talk about it, but it's once again that like just another form of being able to expend energy in a different way.
It's all about like burning calories or tightening. It's like I've totally,
or just like muscle engagement, like muscle tone, or trying to
what I was trying to say. So flexing muscles and just kind of keeping them that way is another way that individuals with eating disorders believe they can burn calories. Yeah. And we are not just verbally assessing them when we're having the interview with them, but we're also observing what's happening in the room. And so those are real common behaviors that we might see during an assessment.
Yeah. Absolutely.
What else do you see?
Ooh, that's a good question. I'm going to have to start thinking about this more and more now.
So one of the things that I'm thinking of is the behavioral problems that you mentioned earlier.
Oh, yeah. That's a good one.
Yeah. So what are some examples of behavioral problems that you see?
Oh, man. What is not a behavioral problem? I feel like it could come out in so many different ways. It could be more arguments. It could be this like kind of, I think a lot of times I think of just arguments around meals in general, whether it's really about the food or even about something else during like the meal time, before, during, or after a meal, if that's kind of like an indicator of just more intensity, whether it's like conflict about the day or something that they were asked to do, and just kind of engaging this odd behavior. That's always a big one. Or there being a lot of like isolation. Isolation, I feel like, is another big one, because you can go with that towards depression, or this just like, I need to isolate and kind of remove myself so I can engage in different eating disorder behaviors.
Isolation's huge. It's one of those ones that we absolutely have to tease apart, because we do see it as a symptom of depression. We see it as a symptom of technology addiction. Yeah. We see it as a symptom of social anxiety. I mean, it's a very common symptom for so many different disorders, but when we're assessing for eating disorders, I think the key follow-up is, well, what are you doing with all your alone time, right?
Yeah.
And are you exercising in private? Are you looking at social media? Are you counting calories? Are you logging your food? How are you engaging your time? Because if they are engaging in eating disorder behaviors, we need to follow up on that.
Yeah.
Another one that I just thought of is baking.
Yes. I was thinking about that too. I was thinking baking and watching like different
cooking shows.
Mm-hmm. Yes. That's always a fun symptom.
So often parents will be like, no, they have no issue with food. They're always, very interested in baking and watching cooking shows, and they love helping me in the kitchen. And so I really feel bad, honestly, when I'm like giving education on why actually these behaviors are associated with an eating disorder diagnosis, because I feel like I'm like bursting their bubble, right? I feel like I'm kind of crushing parents.
I feel like as a parent, you like love when your kid comes and helps, especially like with meals, I know that we're moms and it's like, man, it's so nice when like a kid starts like helping out and like being interested, and it can feel like such a good sign as a parent of like, oh, like this is good, and so
it's interested, they're helping, and they have no issues with food, right? But why, like, what is your experience? Why do we see that individuals who are actually suffering from some sort of malnutrition tend to be more interested in baking and in cooking and watching shows about cooking?
Yeah. And one of the things I love to always do is try to make it as like understandable as possible of like, okay, when you're hungry, what things do you start thinking about? Usually you start thinking about food, which is like a natural bodily reaction. Like our bodies are made to tell us like, start thinking about food, right? And a lot of times you'll start noticing yourself wanting those like high energy type foods is what I like to call them. Like whether it's cupcakes or pizza, just something that's got a lot more energy to it. And like I said, it's like a natural body reaction of making sure that your body is getting nourished. Well, when they have an eating disorder, it's like they start, like their brain is having that effect, but then they can't kind of quite make it to actually eating afterwards. And so they get stuck almost, this is what I think of it as. I don't know if you see it the same way. It's like they get stuck in the cycle of like, I need to be involved with food. I need to like watch food. And it's almost like this, like I'm trying to satisfy that need without actually eating it, but it doesn't resolve it because the only thing that's going to help with that is actually nourishing their body.
Yes. And it goes back to like being brain starved and malnourished, that when someone is so deprived of nutrition, they just can't stop thinking about it. And so that level of interest goes up. So most of the time, when we're doing assessments, we'll learn that individuals who are really malnourished do like to engage in baking. Sometimes they'll bake, but they won't eat the things that they bake, but they enjoy very much watching others eat their baking or baked goods. They may eat what they bake, but maybe just like one piece.
Limited.
Yeah, very limited. And very interested in watching cooking shows and even being involved in the cooking process in the kitchen, because part of that is also a way to exert control over the ingredients.
Yeah, that's exactly what I was going to say, because then they're able to monitor, right? If they're trying to attempt to control what they're putting in their body, they're going to try to control how it's made.
Exactly.
And so knowing, this was placed in here, or like my mom asked me to put this in here. Well, what if I just start cutting it a little bit shorter on this ingredient, or adding a little bit more in this ingredient because this feels like a safe food versus an unsafe ingredient?
Yeah. And honestly, I think that's where I have the hardest time breaking it to parents, because they're really proud of their kids for being involved in the kitchen and taking an interest in cooking and baking. And when I'm like, actually, this is a very concerning symptom of eating disorders, it lets me know that, your child may actually be more advanced on the malnutrition side than we originally thought. We need to really look into this further. So it's kind of sad news for parents when I have to tell them that.
Yeah. But at the same time, I think of it as, right now it's not that true passion. And we want that for them. We want them to really enjoy food. We want them to be able to enjoy baking and cooking if that's something that they truly enjoy. And we don't want it like taken over. So just even thinking about those who are athletes that end up having an eating disorder, what happens is a lot of times that sport now becomes about what the eating disorder wants. So how do I get my body to look a certain way? How do I exert my energy in a certain way versus actually that enjoyment and passion that they originally had. So it's really hard because in that same direction, sometimes you'll have to remove them from that sport, especially when it becomes so enmeshed in the eating disorder, and it can feel so disappointing. And I always try to remind parents, like, it's not that we want to take away this sport. We want to make sure we're rescuing their passion for it, because this is not going to happen where we're at.
Yeah, exactly. So we want them to really be differentiated enough from the eating disorder to be able to decide, is this really a hobby and a passion of mine, or was I just doing it because of the eating disorder?
Yeah. And I've seen it both ways. And I know you've seen it both ways, where sometimes it's like, actually, I don't have that passion. I was doing this because I was trying to please others, or it was a form of exercise. And then for others, it's like, man, you just like completely saved my complete passion.
Right.
Like now I can finally just like love and enjoy the things that I love to do.
I totally agree. I've seen it go both ways. And it's really cool when an individual overcomes the eating disorder enough to authentically determine what feels good for them and realize that they're truly doing it from a good, healthy place for themselves.
Yeah.
That transformation is so fun to watch.
It's amazing.
It's why we do what we do, right?
Yes. Well, I think that's kind of part of it, though, is that there's just something about those who struggle with eating disorders tend to have just a very passionate heart in general, you know, and all of a sudden this passion that they've had is now almost twisted in an unhealthy way that's now harming them or harming their bodies. And so for me, I try not to always like think of it as this is completely, we need to shut this down, right? I'm trying to think of how can we reutilize this passion? How do we turn this passion to something that's helpful and healthy? And I've seen that happen. And I think that's always the beautiful part. When I see someone take that passion, that determination, that drive, and put it towards something positive, you see this like just amazing transformation. You see this like amazing person that the parents like always knew that their kid was, you know?
Yeah, I love it. It's like, again, one of my favorite parts of being an eating disorder psychologist. One of my favorite parts about therapy when we're talking about that passion is when children or even adult clients are fighting us as the treatment team, or they're fighting their parents every step of the way just because they're in that place where, you know, change is really hard, and choosing your authentic self over the eating disorder is truly a long process, and it takes a lot of energy and focus and determination. And so sometimes the client will turn all their energy to fight us as the team, right?
Yeah.
And that exact conversation in therapy can look like, hey, I'm waiting for the day when you stop being mad at me and you start being mad at the eating disorder.
Yeah.
When you take that passion and you fuel it towards fighting the eating disorder and understand that we're actually in this together, we're on your team.
Yeah. Yeah. And I always think it's just, you're right. There's something unique about when that happens. And I hope that, you know, it's always nice when it starts turning to us, because it usually starts with the parents. There's like a passion against the parents. Sometimes it's nice when it just starts aiming towards us, because then it's for us, like we do recognize it, you know, and it is a little bit different of being able to be like, okay, like this is what, you know, there's this passion, you know, and being able to help like the parents or those who are trying to support the individual that's struggling with an eating disorder, being like, no, like, you know, this is passion. This is passion. This is passion. Like, I'm not going to take offense. This is their eating disorder. This is not who they are. I always think that's like a beautiful process of that too.
It really is. And actually, let's spend a little bit more time on that, because, you know, if parents and family members are listening right now and they're struggling with someone in their life who has an eating disorder, it can be very painful. I mean, it can really destroy relationships. It can be really hard to continue to come in and support your loved one with the eating disorder, because they can make it really hard sometimes.
Yeah.
You know? So let's talk about that a little more. I think people really need to hear that right now.
Yeah, no, it's such a unique experience. I think people will talk about like, oh, when you're helping someone that's addicted to other things, right? Maybe it's a substance or different relationships or whatever it may be. But within eating disorders, it's such a unique treatment because you can't just get rid of food or give too much food. It's like really repairing that relationship. And you eat multiple times a day. So it's like if you just step back and think about it, it's not like, someone that's struggling with, let's say alcohol addiction, where it's like, okay, like there's opportunities maybe throughout the week, but they're probably not having opportunities multiple times a day to face that difficulty. And so it is really easy for that to become overwhelming. And it's so hard for family members and friends. It's very confusing because I think for a lot of people, it's like, I don't understand. You just gotta eat, right? Like it feels so simple.
It does. But it's so complex when someone has an eating disorder. And I usually will tell family members, if it was just about eating, your loved one would have done it by now. If they could just turn off that switch, trust me, they would have. It's not a choice. It's really something they're going through.
Yeah.
And we can't just simplify it to, just put the food in your mouth and eat. It's way more complex than that.
And there's so much more deeper emotion attached to that food. And it may not even make sense for everyone else, but like the food or what a certain body type represents means 10 times more. And once we're able to figure out like what that root is, that's when I've noticed families like really kind of almost like relax a little bit of just like, oh, like that's why you're avoiding it. It's not just because I am afraid of gaining X amount of pounds. It's because X amount of pounds means the difference between having friends or not having friends, or it could be even associated with a trauma they've experienced. And so when you can kind of finally piece those together, which takes time, and I always hate that because that's always the hard part, is like continuing to help and making sure we're supporting the families and those who are helping out. I think it's unique because we've seen the whole plethora, right? Like we've seen like every stage, and we've seen different parts of different people's treatment. So it's a lot easier for us as the professionals to kind of like lean in and be like, no, like we're going to figure this out. This is going to happen. I've seen so much transformation. But it is really hard until you figure it out. And so just being able to like trust that there is something more. There's no way that an eating disorder continues without there being something deeper. There's no way.
I totally agree. I mean, it's the difference between the person who goes on a diet and, stops dieting after a few weeks because it's just really not fun to be on a diet. And then the person who takes that diet to the next level, right?
Yeah.
And then needs a lot of help. So absolutely, there's like a difference in that type of person that takes it to the next level. And it's because it's much deeper than just, hey, I want to follow the fad diet today, Another thing I like to tell parents, families, and loved ones of individuals who are struggling with an eating disorder is just don't take it personally. You mentioned it earlier, Dr. Smith, where parents, when they see that transformation in their child, it's almost like they knew that child was that person all along. And that's something I try to do in therapy all the time is I'll try to help the families remember, who was your child or who was your loved one before the eating disorder really took root. Who are they to you? Like, how do you appreciate them for who they are and remember that they are not their eating disorder? Yeah. And, we provide that support as psychologists, not just in the assessment, but also during the therapy process, because we do see clients one-on-one, whenever we can, and do that recovery work with them. And that's a real big part of the conversation we have to keep having with the families is, are you taking care of yourself while you're trying to take care of your loved one? And are you remembering not to take this personally? And if you are, like, let's process that.
Yeah. Yeah. Because it is so important to be able to take care of yourself before you can really assist. I always talk about it as if it's like, you know, everyone has a gas tank. If you're running on E, like it's really hard to keep on going.
Yeah.
You know, like you need to fuel yourself up. You need to be able to take care of yourself so you can expend that energy, because helping and supporting someone that is struggling with an eating disorder does take a lot of energy. It takes a lot of just energy in general, emotional energy, physical energy. It takes a lot.
It absolutely does. It even does for us sometimes.
Yeah.
Like, wow, that was a tough session, or I got to process this case, you know, because this is way more complex, you know, than I realized, or whatever it may be. So, all right. So misnomers to malnutrition is what I think we were talking about.
I know. We've kind of gone off.
I know. So we talked about, you know, it can disguise itself as concentration problems. It can look like an interest in baking and cooking. Fidgeting's a good one.
Isolation. What are some of those other big ones?
So the behavior problems, the one thing that I really wanted to make sure to say, the example that I can think of is, you know, with younger kids especially, it can look like a bad mood. It can look like arguments, kind of like you mentioned, distraction from like what the real issue is. So when you might redirect a child and ask them to do something, or express some kind of upset with them, and they make it way bigger than what you're trying to talk about. It's a way to distract from like what the real issue is.
Yeah.
And then even recently, you know, we have been working with some kids who are threatening to hurt themselves. So I don't want to do that. And if you keep asking me to, I'm just going to hurt myself, or I'm going to kill myself, or I'm going to vomit every time you tell me something I don't want to hear. So these are different kinds of behaviors that we see all across the board, especially the threatening to hurt themselves or kill themselves. Any diagnosis can have those behaviors associated with it, especially in kids.
Yeah.
And the reason we're clustering that under behavior problems is because we know, you know, if you go and ask a 6-year-old, like, really, are you going to kill yourself? They're going to say, no, I just say that when I'm upset, because that's how I get what I want, right? And there's like a true function to why they might be escalating that high.
Yeah.
But in eating disorders, we see some of those behaviors, like maybe not eating, right? Taking out or exerting control in a very young child. I'm just not going to eat, and I don't care if I'm hungry, or I'm going to make myself vomit every time I'm upset, because that gets you to stop doing whatever you're doing that I don't like.
Yeah.
And so we have to tease that apart and really be very careful when we're working with some of those behaviors, and monitor them very closely. But we have seen all of that.
Yeah.
And it ends up just being an eating disorder.
Yeah. Well, and I think just even like in general, feeling like as a parent, you're walking on eggshells.
Yeah. It's very scary for parents.
That's always the hard part. Even if they're not being combated, it's like, just, I feel like anything I say, they tear up. Or if I do one thing wrong, I feel like she's just gonna, you know, isolate more, right? And it may not be like the blatant, like, I'm going to do this, but this like continued pattern of like, oh my gosh, now I don't know almost like how to interact with my child. I don't know how to make things better or make things worse. I don't know what to do. And that's always the hard part. Or I was actually just thinking of another kind of sometimes misnomer. There's this like lack of insight sometimes that will happen. Like it kind of goes with the kind of like the lights are on, no one's home, but there's this just kind of like, everything's fine, you know, everything's good. There's no problems. I have no difficulties. Everything's fine.
And another way I'll describe that to clients when I'm trying to get them to connect with that lack of insight is, do you ever feel numb? Or do you ever feel like you're living your life, but you're kind of observing yourself doing it, so you're not really in your life? And many clients can resonate with that.
Yeah.
I totally agree with that. That's kind of it's a symptom of malnourishment, but I think it's also a symptom associated with anxiety, depression, trauma.
Trauma, yeah.
We see it with so many other kinds of diagnoses.
Yeah.
Yeah. So, you know, when it comes to like all those behavioral problems and some of the things that you were just saying, we are in the assessment process always asking appropriate follow-up questions, and we're really trying to tease that apart. And then what do we do with all that data? I mean, how do you handle it all?
What do you mean? How do I handle it all?
Like, you're collecting all this information, right, for an assessment, and then what do you do with it all?
Well, once I'm able to kind of figure out the root and I start seeing like patterns over time, right? If we're having the fidgeting after dinner, we're having a lot of like arguments around food. If we're having this like control around food, and all of a sudden, you know, maybe on top of that, there's some like nutritional deficits, some other patterns of like getting really conscious about things, like not wanting to go shopping, not wanting to put different clothes on, or getting really fixated on certain appearances. You know, you start kind of seeing this like pattern over time. And that's when I will start bringing those things up with parents, or also just lean into my treatment team, because this is also the hard part is you can't just say like, okay, one thing and here we go, here's an eating disorder. You really got to use that team to really understand all the facets that are going on. There's no way I can do it without the dietitian.
Yeah, I agree.
No way.
And then we take all that information, we create diagnostic impressions, and then we build a treatment plan. And so sometimes we might refer a client to, the Red Clinic, where we can provide services on a weekly basis to them with a therapist or a psychologist and a dietitian. Yep. And then other times we might actually have to refer them up to a higher level of care. And so we're going to take all the information together to come up with the best plan for that client.
Yeah, absolutely.
So it doesn't matter if a client comes in with one of those misnomers. You and I both are going to work really hard to get down to the bottom of it with our team and make sure that the client is taken care of no matter what.
Yeah.
Yeah, that's why I love working with you.
Well, thank you. I like working with you too. It's always nice because, like we kind of said, like a lot of these things are misnomers, right? And so just even being able to like process with another psychologist of like, okay, this is what I'm picking up, like kind of help me out here, right? Like, or with the dietitian, being able to kind of like bounce ideas and being like, okay, are you seeing this? Yes, I'm seeing this too. This is the things that I'm picking up, or these are the things that we're picking up. Or even I think of like times when the dietitian's like, let's go ahead and get blood work, right? Because we're like, oh, there's something about this, you know, there's like that, like there's just enough, but from there, we're able to really kind of differentiate, right? And really help out and making sure that the client is getting what they need, which is just always a beautiful thing.
Yeah. Excellent. Well, that's it. Thank you for tuning into the Red Clinic podcast.